Word on Health, the report with its finger on the pulse of popular medicine, with Paul Pennington. Word on Health, for your very best of health.
To coincide with World Diabetes Day, the charity Diabetes UK has launched a campaign called Strike Out Stigma, which aims to challenge harmful myths and change the conversation around diabetes. The campaign is rooted in a simple but urgent truth. Stigma causes harm, and that's not okay. Blame, judgment and casual comments might seem small to people who don't have diabetes, but they can have a serious impact on mental health, relationships, even on someone's ability to access care or manage their condition. Diabetes UK has found that 8 in 10 people living with type 1 and type 2 diabetes say they face stigma. The charity's CEO is Collette Marshall.
When we talk about diabetes stigma, people tell us that they have to deal with too many false assumptions and negative attitudes. People make judgments about them. So people believe that it's their own responsibility that they have got diabetes. That doesn't take into account there are a huge number of risk factors around type 1 and type 2. People with type 1 diabetes tell us they're judged for using insulin pens and having to inject, or they're judged for carrying tech and wearing the tech that keeps them safe and well. And people think that diabetes is caused by sugar or what they eat. It's all very simplistic and doesn't go into the complexity of the conditions and makes huge judgments around the individual. It affects people on 3 different levels. So first of all, as individuals, people are dealing with hurtful comments from people closest to them. So somebody might say to them, why are you eating that? Or you're not managing your diabetes very well. All these judgments seem to come part of having diabetes. People with diabetes say they'd just like that to stop and just to have the support. Secondly, we see that the parts of society that should be supporting people with diabetes, so healthcare professionals or employers, there are again a lot of judgments made around type 1 and type 2 diabetes, so people don't get the support they should get. We know that about half of people don't go to a healthcare appointment each year because they can't face the stigmatizing or judgmental opinions that might come to them in those appointments. And finally, on that third level, on society level, we know that research, for instance, is massively underfunded into diabetes compared to other conditions. And there's a sort of a view that it's not deserving in some way. That's got to change. Diabetes is a really, really serious condition, and just sort of pretending it's not there or saying it's down to the individual really just doesn't tackle it.
For those outside the 12 million people living with a form of diabetes, could you remind us of what diabetes actually is and explain the key differences between type 1 and type 2?
Diabetes is a condition where your insulin isn't working properly. So what that means in terms of how that impacts people, it means that their cells cannot get energy, because that's what insulin does. Insulin helps your cells take the sugars that are in your blood and convert those into energy. So for anybody out there who wants to know sort of the diagnostic symptoms, you'd be very tired because you're not getting energy. You'd be very thirsty because you've got a lot of blood glucose going around. Your body's trying to flush it out. You'd be going to the loo loads, and you'd be getting thinner because you're not absorbing the energy from the food you eat. There are 2 main forms of diabetes, but there are many others as well. But the 2 main ones that people know about is, first of all, type 1, which is an autoimmune condition. Your immune system has been triggered for some reason we're still exploring to destroy the insulin-producing cells in your pancreas. So you don't have any left, and you're having to take insulin in order to survive. And then for type 2 diabetes, you do still have insulin-producing cells, but for some reason they're not working as effectively as they can do, and therefore you're needing to take some sort of treatment to support you. Diabetes is really, really serious, because what happens is that raised blood glucose in your blood, it damages the really fine veins that you have in all your organs, but also in your fingers, toes and other peripheries. So it can cause dementia. It leads to about 30% of the strokes and heart attacks that people have. It's a leading cause of blindness, and it can lead to amputations as well. So the whole range of health conditions. We talk about diabetes being a gateway to ill health. If people haven't got the support and the really good health pathway around them, then there is this chance of having very, very serious health consequences.
And diabetes has a huge cost impact.
So there's obviously a personal impact and cost to families, friends, and the health of individuals. But in terms of the economic cost, diabetes costs around £11 billion a year, of which more than £6 billion is due to pretty largely preventable complications. So there's much that could be done to reduce that cost, both in preventing type 2 diabetes, but also in helping people who have type 1 and type 2 really manage their condition well.
I know you're keen to stress it's important that everyone with diabetes attends their yearly checks so that complications can be addressed early. We've recently seen the first immunotherapy treatment approved for type 1 diabetes, with others in the pipeline. Stem cell therapy is a prospect within a generation, scientists tell us, and we now have both diabetes prevention and remission programs on the NHS for type 2, which I know Diabetes UK has played an important role in. So there is hope for the future. When it comes to the Strike Out Stigma campaign you've launched, what are you hoping for?
We are hoping that this campaign causes people just to stop and think about the words they use, and to give support rather than judgment, and ask questions of curiosity rather than making assumptions. I think the thing that strikes me most when I talk to people with diabetes is the shame and guilt that comes to many when they're diagnosed. And if we could take that burden away, it's really hard living with type 1 or type 2 diabetes. If we could take the burden of always explaining themselves, of feeling that shame and guilt, that would make a massive difference.
My grateful thanks to Collette Marshall from Diabetes UK. To connect through to the charity, visit our website, wordonhealth.com. That's wordonhealth.com.
Word on Health, for your very best of health.
Each year in the UK, approximately 1,900 children aged up to the age of 14 are diagnosed with cancer. The good news is, advances in treatment mean survival has improved dramatically. Around 85% of children now survive for 5 years or more after diagnosis. Yet, even after remission, many young survivors face long-term physical, emotional and social challenges. Cancer Support UK's Fill a Kit appeal aims to bring practical and emotional support to children through hospital care periods and beyond. The charity's CEO is Mark Guymer.
Children will go through periods of discomfort, pain, fear, isolation at a time when they should be doing what we expect children to be doing, playing with other children, learning, spending time with friends and family. So we wanted to do something that provided support directly to the children, but also would provide an element of support to the family also. And that was where this idea of the Kids Cancer Kit was developed.
What's in each kit and who decides what should be included?
All the items that are in there come from people who have had lived experience, and that's really important. And we continually gather feedback from people and from healthcare professionals to make sure that the items that we're providing really do provide the support we're trying to give. So the types of items that you could expect to find are things that can provide a bit of practical support, but also are engaging for children and provide that moment of distraction, that moment of joy. Probably the most popular item is a very special sensory toy called Warmies. And these cuddly toys can be heated in a microwave, so they can provide that additional extra warmth. Maybe that a child is experiencing a bit of discomfort and pain, so that warmth can be comforting and helpful in that case. They are scented with lavender, which can help with sleeping, and they're specially weighted, which can help with anxiety. So these are really special toys. We provide things like socks. When someone's undergoing chemotherapy, their hands, their feet will often get colder than is normal. So a pair of warm, comforting socks is actually a really, really popular item. But based on the feedback we received, it was important that it was a fun and engaging pair of socks. So the Minions, which is a well-known film franchise, is the branded socks that we provide. And we receive lots and lots of pictures from children that have received those items, wearing their socks, saying how popular they are. And then it's items which will be colouring pens, pencils, books with puzzles, items that can just provide that moment of distraction, which can be so important. Through all these items that go in the kit, the most powerful pieces of feedback we receive is from the parents of the children, who really feel supported receiving items that are provided by people they don't know. And they really feel like people understand a little bit of what they're going through and want to try and make a difference. And that in itself can be one of the most powerful forms of support that you can give someone when they're going through this challenging time.
Mark, last year, Cancer Support UK provided 1,000 kits to children undergoing cancer treatment, and I know you'd like to extend that number next year. What can someone listening to this report do who wants to help you bring a little happiness to children with cancer?
The whole of our kids' kits is funded from the generosity of the public. So what we're asking people to do is to make a donation to help us provide a kit or kits to children with cancer. We know it's difficult out there. We know it's really tough for some people. So you can just fund an actual item. You can fund several items, or you can fund all the items that go into one kit. So there's a whole variety of choices there. And what we're asking people to do is go to our website and you can then make a donation of your choice. And that will directly help us make sure that we can reach as many of the 1,900 children who are diagnosed with cancer every year.
My grateful thanks to Mark Guymer. To link through to Cancer Support UK, you can reach them through the links page of the wordonhealth.com website. That's wordonhealth.com.
Word on Health. For your very best of health.
World Arthritis Day was established in 1996 to raise global awareness of arthritis as a serious public health issue that throughout the UK affects roughly 1 in 6 adults and approximately 12,000 children across over 100 different types of arthritis and related musculoskeletal disorders. It's a chronic condition in all its guises, affecting daily life, work, mobility and well-being. Whilst treatment options are limited and a cure is still out of reach, there are self-management techniques that can help, which a recent YouGov survey discovered only 39% of those questioned with arthritis were aware of. Mark Williams is from the charity Arthritis Action.
Whereas we're very big advocates for getting as much support as possible, at the end of the day, if you have arthritis, you will need to manage the symptoms, manage how it impacts your life, and to make sure that you're making the best choices possible to still be able to do the things that you want to do.
Mark, Arthritis Action for the past 80 years has offered hands-on practical help to improve the quality of life of people affected by arthritis. When it comes to the self-management courses you provide, what are the modules or topics you cover?
The main ones would probably be exercise, diet and nutrition, emotional well-being, pain management, and also planning and pacing as well.
And how are these courses delivered?
So they're done online these days, whether they be a singular event, and then we also have some other courses where we'll split it into 4 different modules, so that way we can delve in a bit deeper into some more of the nuances within each of those topics.
And these are evidence-based courses put together with expert input?
And we work with several different specialists, so we have a dietitian on staff, we have an osteopath on staff, I'm a former personal trainer, we also have a medical advisor for the charity who's a rheumatologist, so lots of different information fed in from different professionals put all this work together.
How do you tailor or adapt content to different types of arthritis or different levels of severity of symptoms?
Self-management works very, very well to be quite adaptable to different people's needs, because you can teach principles about the different aspects of whether it be diet or exercise. You can adapt it to the individual, guiding people down the right paths, and then where they go from there will be up to them, and they can pick and choose which parts of it are going to be most relevant to them, because they may be like, oh, I'm fine with my diet, I've got no issues there, but perhaps they can learn something about pain management, or perhaps they can learn about pacing.
What evidence or feedback do you have that your arthritis self-management courses actually improve people's quality of life, pain control or function?
One thing we're always very keen to do after them is to hear what participants or members have experienced and what they've got from it. So we can always make sure that what we're doing is what people want. Because if we start to see a trend of people wish we were talking a bit more about whatever it may be, then we'll make an effort to go out and create some more content and make sure that we're giving what people actually need. It's a difficult one to quantify, really, because it's quite qualitative, a lot of it. It's about people's physical experiences afterwards and how they manage to deal with their pain. Some of the positive feedback we've had from some of the courses will be things around they didn't realize that they were putting too much stress on themselves by trying to achieve too much. And they didn't realize that it's okay to have a day off sometimes. Sometimes your body needs to recharge. And that's one that I hear quite a lot from these, is people almost being given permission to take a break and to have a rest and let their body recover. And we've had some really good testimonies from some of the people who've been involved in our courses or been involved with us in general. For example, one woman that I interviewed at one point, she was telling about how she started doing a bit more exercise, started eating a bit better and taking better care of herself. And she'd been able through that to start using her body a bit better and started playing darts again, which is something she hadn't done in years because, just moving her shoulders around was too much. And she's now planning on taking up bowls as well after this as well. So the transformations that some people can make from this, it's just so rewarding to hear, and I'm just so happy that they're able to do so.
My grateful thanks to Mark Williams. To link through to Arthritis Action to learn more or get involved with their self-management courses, you can find them through the links page of the wordonhealth.com website. That's wordonhealth.com.
Word on Health, for your very best of health.
A recent community survey by the charity Muscular Dystrophy UK found that 84% of respondents living with a form of the condition that affects around 110,000 people of all ages across the UK identified increasing the understanding among non-specialist healthcare professionals as a top priority. The findings strongly imply that awareness among the general public is likely low, given that even healthcare professionals admit limited exposure or training on neuromuscular conditions. Dr. Charlotte Roy is from Muscular Dystrophy UK.
Muscular dystrophy is a group of rare conditions that gradually cause muscles to weaken and waste, and they are conditions that progressively get worse over time. Currently, there's no cure for muscular dystrophy, but there are advances being made in finding effective treatments. There are many other conditions that also cause muscles to weaken and waste. And as a charity, we cover around about 60 different types of conditions, and these are usually inherited. They're caused by changes in our genes. Symptoms can vary dramatically behind different conditions, and the age of which symptoms occur can be very different for each person at all. And these conditions don't discriminate. They can impact anybody, any age, anywhere across the UK.
What might be the early warning signs that a form of muscular dystrophy might be present?
So as there are over 60 different types of conditions, they can present all very differently, so it can make it really difficult to kind of pinpoint warning signs. We'd say that general tiredness, muscle aches, or any feeling of muscle weakness would be a first sign. And with that, we suggest going to see your GP at first port of call.
You mentioned the genetic component and how forms of muscular dystrophy are inherited. So I guess families will already know there's a possibility that the condition, in whatever its guise, might manifest itself in a person's life.
That can be the case. Sometimes conditions may be misdiagnosed, so people might not be sure of it. There are other occasions where the change in the genes can happen randomly as well, so it might not be that there is a family history. But it's only having those conversations with the GP does that sometimes click into place and recognise that that's what's happening.
It has to be said, diagnosis of what are rare conditions can be difficult, with many GPs not seeing a single case across their career. And it's claimed many health professionals outside of neuromuscular specialities have never heard of these conditions, let alone be trained extensively in them. The Muscular Dystrophy UK Community Survey revealed that 47% of respondents had experienced a misdiagnosis and 55% needed 4 or more consultations with healthcare professionals before being diagnosed, and the patient experience can vary greatly. Vicki Nash is Director of Campaign and Policy at Muscular Dystrophy UK.
The challenge that we've got when you look at how diagnosis happens across the UK is that people have really different experiences. Some people might be diagnosed face-to-face, they'll be handed a lot of support, information, and they'll be put in contact with their specialist care advisor, and they'll be given almost like an arm that comes around them to say, we're here, we're going to work through this journey with you. In other cases, they're told over the phone in complete isolation, very limited follow-up. Might be that they don't then have another conversation with a specialist for like another year, particularly if there's no treatments available. You're really left to fend for yourself. It's really patchy though, Paul, depending on where you are geographically, what your condition might be, and the journey it's taken you to get to that diagnosis stage. So it feels like a postcode lottery. So what us at the charity have been trying to look at is how do we help provide some of that wraparound support so that everyone feels like they've got someone that they can face that journey with. And we need to be making sure that wherever you live, you get a similar quality diagnosis and really high quality follow-up care and support from a whole range of specialists that can come in and provide you with that support.
My grateful thanks to Dr. Charlotte Roy and Vicki Nash from Muscular Dystrophy UK. To find out more and link through to the charity, visit the wordonhealth.com website. That's wordonhealth.com.
Word on Health On air and online 52 weeks of the year with Paul Pennington. Word on Health, your personal prescription for your very best of health.